average, we ask about 40,000 questions between the age of 2 and 5. It steadily declines afterward. And I know in practice, it declines even more. I get in my rut of seeing patients over and over again, and I start to just do things that are comfortable and things that I did with the last patient. And that had to stop. So last week I was like, why am I performing traction on all these patients? So I dug into research and I found out why I perform something in my clinic. Lumbar spine traction is used by a lot of different providers, including myself, chiropractic, orthopedist, physical therapist. But why do we do it? Well, it turns out there is a big population of patients that benefit from lumbar spine traction. Traction is usually applied intermittently, and it's usually between 20 and 50% of somebody's body weight. So why do I perform traction, and why should you possibly consider using traction? Well, as it turns out, we need to provide motion to patients. Not only provide the passive modality of the lumbar spine traction in your office, but also explain why you're doing that. Now, you can use the infographic in this blog. Now, that's good for the patient and possibly also a little bit of good marketing when they bring that home to their spouse or their neighbor or their medical doctor. But really what you're teaching the patient is, I need you to start moving. Constant compression from gravity, constant compression from being sedentary in your spine is no bueno. We need to get you moving. We need to get people moving. There is no better person than chiropractors. Now, the second part of this is we need to make sure we're giving traction to the right people. And when we look at the 2 clinical prediction rules that I included in this blog, there is one common theme, and I'll admit, it's a big evaluation in my office, and it's a big predictor of future success with my patients, and it's a lack of extension. Look at extension directional preference. It's in Chiro Up. I highly also recommend looking at McKenzie's seminars, which will go much more in depth into the evaluation and the treatment using directional preference. However, these patients who need movement, in fact, extension is the first range of motion that's lost in lower lumbar spine with any kind of injury. When we can restore that in office, spinal manipulation, lumbar spine traction, those are phenomenal tools to improve that, and then sending them home with the right set of rehabilitation exercises. So don't consider lumbar spine traction as an end-all be-all. We know with musculoskeletal care, there is no one solution. However, it is proven that lumbar spine traction does have merit and can have positive benefits with a lot of different patients when used in conjunction with other therapies, including spinal manipulation and at-home rehabilitation exercises. I hope this blog helps. Check out the download as far as the infographic, and then also consider delivering that along with your condition reports in Chiro Up. Thanks for listening.